Hi, I'm Dr. Dai Lao Rodriguez. I'm from Mexico City originally. I recently moved to Chicago, and I'm a dentist. I specialize in implant dentistry and aesthetic dentistry. Also, I'm a ceramist, a lab technician. So I try to combine these two workflows in my day-to-day practice. I try to manage both surgical procedures and also the restorative part of them. So in that way, I'm much more in control of the procedures that we do here. I come from a family of dentists, so both my parents are prosthodontists and ceramists as well. We do have a practice in Mexico City, and also we have a lab, an in-house lab, where we produce our own restorations with our own ceramists and lab technicians there. So also I have aunts, uncles, I have cousins that are dentists. So I've been growing up always in this type of environment that also, of course, like I think influenced a little bit in my decision. But definitely yes, I really liked it since I was a kid because I grew up around it, so that was very beneficial for me. A long time ago, before being a dentist, I started being a dental technician. So I really started liking dentistry from then, and I just wanted to keep learning more and more about dentistry. That's why I went to dental school afterwards. And then when I finished dental school, I wanted to specialize in the things that I really like the most out of dentistry, right? So for me, it was out of the different specialties, I picked one that is more surgical and another one that is like more prosthetic. So I really like that workflow in between both of them, so I can actually treat the patients comprehensively in both worlds. For me, the most exciting part, it's definitely like the surgical part, because it's where what I really enjoy about like operating the patients, treating the patients. But definitely a very important part for me is also like the final outcome, right? Just to see how the patient smiles after we put in the prosthesis, when we're doing full arch, or we're doing like a full set of veneers or a full mouth rehabilitation. That like last part where the patient gets everything, and seeing the reaction of how happy they are when they finally get the final prosthesis and they're able to chew again, they're able to function again normally. That for me is the greatest part of all. In the implant dentistry world, we have the surgical part and also we have the restorative part. Both are equally important, but of course there's a synergy between them that would lead to the success of the case. So being able to do both, actually, for me, it has been quite better, because I'm much more in control for the restorative part, which is the outcome part, what the patient wants to see. And of course, we are interested in the long-term solution that we give to this patient, which is it's in its foundation, right? In the foundation of the treatment, which is the surgical aspect, right? Choosing and picking the right bone graft in the right clinical scenario, knowing, like, for example, how deep to place an implant, the exact position to place an implant, to know the restorative part, so we can actually also in the lab produce the restoration with the right materials, with the right abutment, with the right screws, so this kind of prosthesis lasts as long as possible. So it's very important for us to have like a very complete team of professionals that also take care of the patient. So meanwhile, for example, I'm doing the treatment in the patient. I know there will be someone that will follow up with them if they need anything. Our team of our clinic managers, of front desk, the assistants are super important. And here we have very well trained assistants, and that can help us in the surgery, they'll help us with the scanning process, that will help us with anything that comes up with the surgery. Meanwhile, I'm focused, like completely focused on like the procedure itself. They will help me to do everything else. Also, our lab technicians, it's super important to rely on them because I know this part, so I know it's very important to give them like a lot of information about like the clinical aspect of the patient, and also try to communicate as much as possible with them and with the patient in order to have a very good result and very good outcome. One of the things that I've heard the most from general patients is that they think that the implant process it could be painful, but it's the other way around. Actually, placing an implant, it's a very straightforward treatment. I would say it's like even more difficult to do a root canal maybe than to place an implant. So actually it's very straightforward treatment, no pain at all, just because we do numb the patient locally, we do local anesthesia. If some patients have dental anxiety, then we are more happy to provide them with different solutions such as laughing gas, or we can do some in-house sedation sometimes when we're doing bigger treatments. So the patients will never be in pain during this procedure or even on the post-op. Now for also another like misconception is that the implants fail in a short term. That's also, we have patients that have had prostheses and over implants for more than 15, 20 years without any issues, and of course we expect them to last way more longer than this. But of course it's a very, very straightforward procedure, and it's a very safe procedure to do. And also at the third one and last one, it's that some patients could be allergic to implants. So our implants are made of a very good titanium alloy, which is one of the most biocompatible materials, and they're highly sterilized. So the minute we take them out and put it into the patient's bone, they start a process of osseointegration that will actually allow the patient to have a crown after that. So all of this is very safe, all of this is very straightforward, and usually there's no big complications around these procedures. Not so long ago, I would say maybe 10, 15, 20 years, we didn't have these many digital systems that we have nowadays, right? For us to think about like a 3D printer that could actually print a permanent crown or semi-permanent crown in just like 8-10 minutes, it was like unimaginable. So in just like 10 years or even less, a lot of companies in the dental industry started developing this type of technology. And also it goes from also the surgical part, from CBCT scans towards production, like restoration production, such as milling machines, dental scanners, intraoral scanners. So all of these actually made our workflow in the office quite simple, and it makes it way easier for us, way easier for the patient. But 20 years ago, it would be unimaginable to have all of this. I wouldn't imagine, and I don't imagine what we're gonna have in maybe 5 or 10 more years. It's gonna be way more predictable to have very good fitting restorations, very well placed implants, and of course, one of the pinnacles in dental history is the robotic part, right, of dentistry. There's robots right now placing implants by themselves, of course guided by someone, by a human. But definitely I think in the future we will have a lot of more robotic things coming up, automated robotic workflows, but definitely thinking about that, it's something super innovative that I could see happening for sure very soon. But with all of this technology, we're able to be more predictable and also to bring care to more and more patients every day, right? To make it simple for them and to make it easy and painless for them. Come see us because they will be surprised about the treatments that we offer here. They will be, of course, I think they're very interested in the ones we offer here because we have the best high-end technology in the office. We have the best printers, the best scanners. We have also the best staff over here as well. And we try to make the treatments very, very, very straightforward, very short, so they don't become painful to the patients, or they don't become like an extra thing to do for the patient, right? So we try to help the patient as much as possible, of course, and we also try to make every treatment just as straightforward as possible, just to make them also enjoy this journey as well, especially if one patient is going through a big treatment. We just try to make it very, very, very smooth for them, so they don't have to worry about this part in their life, and also take care of different things in their lives day to day.